everyone, Dr. Laura Neville here. Recently had some really great questions from some members in the group, so I wanted to address those in a video here. I find a lot of people enjoy watching videos and they can listen a lot better than time in the day is left to read. So hopefully you also agree with that and enjoy this video. So I wanted to talk to you today about fibrocystic breast changes. So this is a fancy word for basically tender breasts, painful breasts, or things that have been noticed on imaging, maybe mammogram. So this is a non-cancerous, sometimes a growth of the entire tissue, a density of the entire tissue in the breast, or they can be separate kind of fibroids or cysts themselves that are more localized and in one area. We don't 100% know the reason for these, but most likely they are linked to kind of ebbs and flows of hormones. So a lot of women will notice when they're cycling or where they were cycling in the past that their breasts would get more tender prior to starting, their menstrual cycle, and then that would go away once their menstrual cycle started. So we know that there are ebbs and flows and ups and downs of hormones that change throughout the cycle. And so we think there must be a connection there. I will say for some women, it seems to be more obvious than other women. And we think that has to do with an exaggerated response to the normal ebbs and flows of hormone changes. So women that tend to have more inflammation in general in their body, chronic inflammation, can sometimes be more sensitive to the ups and downs of hormones. So they might have more symptoms, more breast tenderness, more swelling, things like that, and more density, more fibrocystic changes of the tissue itself. So decreasing inflammation is going to be key to addressing this. There are many ways to do that. Always has to start with diet. I know we don't want to hear that, but diet's going to be a key piece to that. So eating foods that your body responds well to. For one person, the same food is inflammatory. For another person, it's the best food ever. I would say hands down the best diets that have been studied, or the diet that has been studied the most effectively and we have the most research on, is the Mediterranean diet. So it's very heavy in fruits and vegetables, some grains, although I would caution likely at this point for most people to stay away from the gluten heavy grains, because they're harder to digest. No matter what you have going on, they're hard to digest. So a lot of people are not responding well to that. If that's glyphosate too, in the soil and the crops, probably. But nonetheless, lots of fresh olive oil, and it's heavy in plant-based. There is meat included. It's not daily. And so this is a diet I would say for anyone that's wondering, like, what diet should I start on that's anti-inflammatory? Good case can be made for Mediterranean diet for most people. Not to say that sometimes a paleo diet, something like that, more of a lower carb diet is appropriate for other people. It really depends on your situation, but the food has to be whole food. It has to be heavy in plants, plant material, fruits and vegetables, so that it can decrease inflammation in your body. Fish oils can be wonderful to decrease inflammation. Turmeric is also amazing to decrease inflammation. There are a ton of botanicals that can be used to balance the menstrual cycle, balance the symptoms of the menstrual cycle. And I always tell people, there's a whole variety of them. You can find a lot of formulas out there that combine a lot of these herbs and nutrients into one capsule so that you're not taking 10 different things. You do have to be very patient with botanicals. They can take at least 90 days to start showing changes in the body. So some women are just not motivated to take botanicals or capsules like that every single day for far longer than 90 days, but 90 days minimum to notice any change. So we have to be aware of that and know that this is a long-term approach. It's not going to change overnight. So again, decreasing inflammation. Now, a lot of times conventionally, the birth control pill will be used to decrease fibrocystic changes. This is because it's actually stopping ovulation from occurring completely. So you're no longer having a cycle. You do have a breakthrough bleed. A lot of women have that. So it's not often known that you're not ovulating. That's the whole mechanism of the birth control pill. And that will basically drop your hormone levels enough to where that ebb and flow is not occurring. And so a lot of symptoms are going to decrease because of that. Is that the best way to handle that long term? In my opinion, no, because you're just suppressing ovulation entirely. The body ovulates for likely very good reason, not just procreation, but I think there are health benefits to that. And so if we're using birth control pill to simply stop ovulation, so therefore we don't have hormones to be jumping up and down, we're not really addressing the issue. Now, if the fibrocystic changes are bad enough and it's inhibiting your life enough that the oral birth control pill might be a way to handle that for a time, there is also argument to say that that is more beneficial, better benefit risk ratio in that case. So totally depends on that situation as well. And then I wanted to address also that estrogen, one of the main roles of estrogen is to grow tissues. It has what we call a proliferative effect. Progesterone, on the other hand, stops the excess growth and tells estrogen when to basically calm down and stop growing. So you want growth, but you don't want too much growth. With fibrocystic changes, we wonder, is there too much estrogen, not enough progesterone? So there's an imbalance between the two hormones. In most cases, you may not necessarily need to drop estrogen levels. Sometimes you do, but more so you need to help progesterone levels and boost those. So you can do that by boosting the strength of the menstrual cycle. If you're no longer menstruating, you need to use progesterone in an exogenous or outside form. Take that in order to get your progesterone levels up high enough to where the estrogen is kept in check, so less growth. So that definitely can play a role as well. Vitamin E has been studied to reduce fibrocystic changes in some women. There are several studies out there. Not all of them show change, but some of them do, so it is worth considering. So vitamin E can do that. Avoiding caffeine and some substances that are also within caffeine, I'm not even going to name, they're called methylxanthines. Not necessary to remember that word, but nonetheless, those are found in coffee, tea, cola, and chocolate. So as much of that as you can reduce, that does seem to have really strong indication in the research to reduce fibrocystic changes. So oftentimes, even in conventional medicine, they're going to ask that you reduce or eliminate your coffee, which is a tough one. Coffee, tea, again, soda, and chocolate. There are several studies out there indicating that that is very helpful. There was one study in particular that saw a reduction in breast changes 1 to 6 months after 1 to 6 months of reducing or eliminating the caffeine and methylxanthine intake. And they found that in 65 to 88% of the patients. So that's a really good indication. What I think is happening there is that it's relating to inflammation. Caffeine can be inflammatory, and so I think that's probably what's going on there. In this study, the benefits were less pronounced in the women who reduced their intake of these substances but didn't eliminate it at all. And then women who were 45 years of age or older, it looked like they needed about a year before their condition resolved, as opposed to 1 to 6 months in the women that were younger than that. So again, these are treatments that, when you're truly getting to the root cause of the issue, can take quite a long time to resolve. So we always have to remember that. I think, not any of our faults, but we've been raised in a society where a tablet can fix your symptoms within a few hours or one day. We're never fixing the symptom or the issue at hand when we use something like that. We're suppressing the symptoms of it. We're not addressing the root cause. And so that's a huge paradigm shift that has to take place for us to understand how to treat our bodies, how to be patient, how to wait a little bit longer, to know that true healing is being reached. I think that's one of the hardest and most challenging things for patients of naturopathic medicine. We have to realize that these sometimes can take a really long time. What else do I want to talk about? Last part is iodine. So iodine has been also studied to reduce fibrocystic changes. Iodine is really interesting. It's heavily concentrated naturally in the body. The number one gland that's most concentrated is the thyroid, and then second would be the breast tissue. So very important, I think, for breast health, absolutely. We do have to be a bit cautious of iodine supplementation, especially if there's thyroid disorder that's going on or borderline. Too much iodine, and iodine, even in decent doses, can cause thyroid changes in some people. So that has to do with, I think, dosing, the type of iodine being used, and working with a physician so you're not doing this on your own, and your levels of thyroid hormone and your antibody levels can be tracked really carefully to make sure you're not pushing into a dangerous place for your thyroid. So anyway, I hope that helped. Fibrocystic breast issues and changes are very, very common in so many women. Seems to be most common around the age, somewhere in the 40s. And this is where we think there's just the most amount of hormonal changes going on. We're starting maybe at 45 and on to get into that perimenopausal age range. And a lot of these ups and downs can really cause a lot of symptoms. So fibrocystic breast changes are not necessarily, they call them a benign issue, so they're not related to any overt pathology. They do not seem to be connected to breast cancer, although I've seen some physicians and studies that do have a weak link there. So, really it comes down to looking for that root cause. You may be offered oral contraceptive pill by a conventional doctor. Sometimes that's an okay choice for the time. I would always argue that we need to look further and deeper than that to make sure we really address the issue and decrease the symptoms. Okay, thank you so much for joining me. I'll talk to you guys soon.